What is dementia? According to Burgoyne, Seaman and Service, dementia is defined by a loss of previous levels of cognitive, executive, and memory function in a state of full alertness. Dementia has a slow, insidious onset and is chronic, progressive, and irreversible. Statistics and incidences shows that the cases of dementia are increasing due to longer life expectancy of the world's population. There are four clinical dementia syndromes accounting for 90% of all the cases after excluding other common reversible causes of cognitive impairment. The rise in dementia and Alzheimer's diseases is alarming and is expected to double every 20 years from 47 million people in the year 2015 to 75 million people in the year 2030 and 131 million in the year 2050. Following are the major etiological categories for the syndrome of dementia: dementia of the Alzheimer's type, vascular dementia, dementia due to HIV disease, dementia due to head trauma, dementia due to Lewy body disease, dementia due to Parkinson's disease, dementia due to Huntington's disease, dementia due to Pick's disease, dementia due to Creutzfeldt-Jacobs disease, dementia due to other general medical conditions, and substance induced persisting dementia. The clinical manifestations of dementia include memory impairment, impairment in the ability to learn new information or to recall previously learned informations, impairment in abstract thinking, judgment, and impulse control, impairment in language ability such as difficulty in naming objects. In some instances, the individual may not speak at all. Personality changes are common, impaired ability to perform motor activities despite intact motor abilities. Disorientation. Patient may feel disoriented regarding current place, time, names of persons they are close with. Wandering. Because of disorientation, patient with dementia may often wander from one place to another. Delusions are common, particularly delusions of persecution. Assessment and diagnostic findings include the following laboratory tests: CBC, complete blood cell count. The abnormalities in CBC and cobalamin levels require further workup to rule out the hematological diseases. Liver enzyme levels. Abnormalities found in liver enzyme levels require further workup to rule out the hepatic diseases. Thyroid stimulating hormone levels. Abnormalities in TSH levels require further workup to rule out the thyroid disease. Rapid plasma reagent. Abnormalities in the RPR require further workup to rule out syphilis. HIV serology. Abnormalities in HIV serology and or PCR require further workup to rule out the HIV/AIDS. Paraneoplastic antibodies. Abnormalities in the paraneoplastic antibodies require further workup to rule out the autoimmune encephalitis. CSF proteins. Abnormalities in CSF proteins, tau, p-tau, and 1433 require further workup to rule out the Creutzfeldt-Jacobs disease. Dementia is managed medically by experimental therapies. A variety of experimental therapies have been proposed for dementia, like anti-amyloid therapy, reversal of excess tau phosphorylation, estrogen therapy, vitamin E therapy, and free radical scavenger therapy. However, results of these studies have yielded disappointing results. Dietary measures. There are no special dietary considerations for dementia. However, capryridin, Axona is a prescription medical food that is metabolized into ketone bodies, and the brain can use these ketone bodies for energy when its ability to process glucose is impaired. Brain imaging scans of older adults and persons with dementia reveal dramatically decreased uptake of glucose. Method which is managed medically is by physical activity. Routine physical activity and exercise may have an impact on dementia progression and may perhaps have a protective effect on brain health. The patient surroundings should be safe and familiar. Maintaining structured routines may be helpful to decrease patient stress in regard to meal, medication, and other therapeutic activities aimed at maintaining cognitive functioning. Pharmacological management. The mainstay of therapy for patients with dementia is the use of centrally acting cholinesterase inhibitors to attempt to compensate for the depletion of acetylcholine in the cerebral cortex and hippocampus. The medications used are cholinesterase inhibitors, which are used to palliate the cholinergic deficiency. N-methyl D-aspartate antagonist. The only drug in the N-methyl D-aspartate antagonist class that is approved by the US Food and Drug Administration is memantine. This agent may be used alone or in combination with ACHE inhibitors. Nutritional supplement. Medical foods are dietary supplements intended to compensate specific nutritional problems caused by a disease or condition. Caprolidin is indicated for clinical dietary management of metabolic processes associated with mild to moderate dementia. Thanks for watching. If the contents of this video are informative and useful, like the video, comment the video, share this with your friends and colleagues. Do not forget to subscribe the channel and click on the bell icon for more updates.